Breastfeeding is one of the most beautiful connections between a mother and her baby. But did you know there are several positions that can make feeding more comfortable for both of you? In this video, we'll explore 5 effective breastfeeding positions that every new mom should know. Let's get started. The cradle hold is one of the most common and natural breastfeeding positions. Sit comfortably, hold your baby across your chest, and rest their head in the bend of your arm. Keep your baby's tummy facing yours. This position helps create a warm, close bond during feeding time. In the cross-cradle hold, you use the opposite arm to support your baby's head. This gives you better control and helps your baby latch properly. Use a pillow for support if needed, and make sure your baby's nose is at the level of your nipple for easy feeding. The football hold is great for mothers who've had a C-section or have larger breasts. Hold your baby tucked under your arm like a football, supporting their head with your hand. This position keeps pressure off your stomach and gives you a clear view of your baby's latch. The side-lying position is perfect for nighttime feeds or when you're resting. Lie on your side with your baby facing you. Keep both of you in a straight line, nose to nipple. This position is relaxing and helps both mom and baby stay comfortable. The upright or koala hold is ideal for babies with reflux or ear infections. Sit your baby upright on your lap facing you while supporting their head and neck. This position keeps your baby's airway clear and makes breastfeeding more comfortable for both of you.